You're listening to the Mother to Baby podcast, medications and more during pregnancy and breastfeeding. Ask the experts with your host, genetic counselor and mom of four, Chris Stallman.
This episode contains evidence-based information that's current as of the day recorded and may change as more data becomes available. To get the very latest information about this topic or other topics in pregnancy and breastfeeding, please contact a mother-to-baby specialist at 866-626-6847, by text at 855-999-3525, or through our website at mothertobaby.org. Welcome to another episode of the Mother to Baby podcast. My name is Chris Stallman, and I am a genetic counselor, a mother of four, and a teratogen information specialist. So what that means is I talk to people, so patients, their families, and providers, about exposures that can happen before or during pregnancy, while breastfeeding, or in cases of adoption. And an exposure can be anything. So it could be nail polish, it could be chemicals at your job, it could be a medication or a vaccine. On today's show, we have a very special guest, Kimberly D. Harper, a registered nurse with 17 years of experience in maternal and child health. Her experience ranges from leadership and nursing roles in labor and delivery units, postpartum care, public health home visiting programs, and hospital administration. She holds several roles at the University of North Carolina Center for Maternal and Infant Health, including providing training and technical assistance to state and national maternal health initiatives. And she is the perinatal neonatal outreach coordinator. She is also a member of the Fourth Trimester Project team, which is the focus of our podcast today. Kimberly, welcome to the show. Thank you for being here.
Thank you for having me. I'm excited to have this conversation today.
And we are as well. So one thing that I didn't mention is that you're also a mom of two. Is that correct?
That's correct. I have two kiddos. I have a little girl, Christina, and a boy, Caleb. So it's actually one of the reasons why I wanted to join the fourth trimester team. Kind of led into my journey here.
Great. And so let's just take it from there. What is the fourth trimester?
So the fourth trimester, for our purposes and focus, is those first few weeks after delivery. A lot of people will say like up until 6 weeks, but we know that the postpartum period can extend up until the first year. So it's really that period after having a baby and making that transition after you delivered.
And what is the Fourth Trimester Project, and why was it established?
So the Fourth Trimester Project is a project that's dedicated to serving families and mothers and birthing people as they transition into the postpartum period. What we realized is that we have been focused so much on making sure people have like the baby showers and the getting ready for the baby to be here, the nesting and all those things, but we don't always prepare for that half or what happens after you've had the baby. And so that postpartum period, it's like we've neglected it and people don't really know. They don't, it's kind of like you have the baby. I remember when I had my son, I delivered and then it was like, oh, this isn't what I expected. And nobody told me about it. And nobody talks about the postpartum period. But then after I had my child, all the mothers came over to me and they were like, oh, yeah, that's what happens. This is what the fourth trimester or the postpartum period is like. So our goal is to kind of give you the information ahead of time so that you're not thinking about what happens in that postpartum period and you can better prepare so that you don't just survive the postpartum period, but you're actually thriving in the postpartum period. So that's why we're here to improve the outcomes that we have and to make this transition into being a parent easier.
And that's really awesome to hear because, I've had 4 children and I work in healthcare and I have for quite a long time. And it's not until the very recent past that I even heard of, this term, the 4th trimester. Of course, I'm familiar with the postpartum period, but it never occurred to me in any of my pregnancies that I should be thinking about that time and getting organized and being prepared. So it's so great to hear that there's a program out there for this. And your program is located in North Carolina. Is that right?
Right. So the 4th Trimester Project, we are based at UNC Collaborative for Maternal and Infant Health, but we also provide support as a national initiative. So we work with some of the national organizations to help build different processes and policies within systems to change the postpartum care. But then in North Carolina, we are also specifically working with different doctors' offices and practices to redesign how postpartum care is given. And one of the ways that we do that is connecting with people that have given birth in North Carolina and actually working with them together to create tools and to create patient education materials and to provide feedback about how their experience in the postpartum period or after delivery impacted how they were able to move on after they had their child and transitioning and even going into the next pregnancy. And so we're focused on not just supporting individuals, but looking at systems change and trying to transform the lived experience or how people are actually going through this postpartum period and actually changing the process.
So it sounds like you have certainly some local activities going on, but as you said, also, at the national level. So my guess is that there's some common questions that you get. So what are the 2 most common questions you receive regarding the postpartum period?
Maybe the first question is related to how do I get prepared for it? Or how do I help from the provider's standpoint? How do I help my patients get prepared for this process? And I think part of it is people don't know how much to say before you get someone ready. For instance, do I tell them about what can happen in delivery and what happens in the postpartum period immediately? Or do I just wait until they have their baby and talk about the process? And what we found is actually telling people ahead of time what to expect. It's almost like the book, What to Expect While Expecting. I know I had that book and I read it a lot when I was pregnant, but nobody has a book about what to expect in the postpartum period because they don't know, should I talk about this? But what our research has shown is that we do need to have that information ahead of time. There's research that shows that if you're able to give just 15 minutes of what might happen in the postpartum period of talking to people, it can actually reduce postpartum depression, increase breastfeeding rates, and helping you to be successful because you know what's going to happen. And so finding the right time to tell that education is probably the first question. And then I guess the next question might be, how do I connect people with the resources that's needed and building that village for the postpartum? And well, not just postpartum, actually, I would say building the village for caring for the child. And that's looked a little different these days, especially with COVID. We noticed in 2020 when people were separated, they didn't have families right near each other, and that building that village looks very different. So how do we build a community to help support us navigate this transition in life?
What are the 2 most helpful tips in preparing for the 4th trimester?
So I would probably say the 2 most helpful tips are connected to some of the tools we have. We actually have tools online at newmomhealth.com, and we have the tools to focus on the postpartum care plan and getting prepared and having those conversations ahead of time. So being able to think about what might be needed during this time frame. I know for me, one of my struggles was trying to figure out how to balance going back to work and childcare because I didn't want to be separated from my kiddos or my, especially when I had my first child. I wanted to be there as long as possible, but it was hard for me to think through what that might look like and what would need to happen during that time. So we actually created a postpartum care plan. And on that care plan, it has different aspects to think about. Communication. Who do I want to have a conversation with before I have the baby or while I'm having the baby? And who do I want to post things online? Simple things. We're able to talk to people and find out that some of their concerns were related to like people posting things on social media. One of the things that came up in a focus group was they were having a baby, and before they could get out and announce it themselves, one of their friends posted a picture of their baby. And so it's like, it's kind of hard when you have that ahead of time. But if you think about, nobody thinks about social media posting when you're pregnant or in the postpartum, like right immediately. But just talking about it ahead of time helps you to plan about these things. Another piece was thinking about what food you might need, because you don't really know what it's going to be like. And people are always wanting to bring over food to you or help you because they know that there's a need. But how do I do that effectively? There was another story that we had where someone's family had packed up, I think, enough food for months, and they had made like lasagna and meatloaf and chili and all these different things, and they brought them over to the family, and it was all like meat and beans and things like that, but they were vegan. And so I said, well, if you would have asked me what I wanted, it would have been easier. But people don't know how to have those conversations, or they don't think about those conversations if it's your first child. And if it's your second child, you might have forgotten about it. So what we found is this postpartum care plan has been very helpful in helping you to prepare for that transition. The other thing that we found when we were talking to people about that postpartum period is that they have all these family and friends available to help and wanting to be available to give them the things they need. But if I remember for me, after I had my son and I came home, like those first 3 or 4 days, if you asked me what needed to happen or what you could help me with, I would just say, I have no clue, because I just, like you said, this loss. And that's what people were saying. They had this help, but they didn't know what to tell them because you're tired. You're trying to take care of a new person, human being, and yourself. So thinking about that ahead of time, and figure out what do I feel comfortable with asking for help with, and being able to say, these are the 4 things that I think that I can have people help do if they come over. And that way you don't have to think about it when you're sitting there 3 days after having a baby and telling them what they can do. You can have that conversation early.
I agree. And, for my situation, I currently live in Arizona, but I'm not from here originally, and we don't have any biological family members out here. My family lives all on the East Coast, and my husband is actually from another country, so he doesn't have any family here either. And so your point of, if you know in advance, you're going to need meals done now, you're going to need laundry done, and you're going to need help with it. As much as in my own mind, I'd love to say, sure, I'm going to do everything while my baby sleeps for 15 minutes. It's not going to happen. And so being able to have that plan, even though it's just my husband and I, having a concrete list for him to go off of so he doesn't have to ask and I don't have to tell, it's just right there. So I think in so many circumstances, having that plan, regardless of your family situation, is probably going to be pretty helpful.
Yeah, and I think the other point that you brought up with partners and having people there to actually help, what we found is that there were a lot of partners, both fathers and other partners and spouses, that didn't know what to do. Yeah. And they wanted to be more involved, but they felt like they couldn't be involved because they were never told what they could do. And so it helps to make everyone be included in the process. I know I heard from my children, I breastfed both of them, and I remember the first few weeks just trying to get everything settled, and I didn't really pump a lot. And my husband was like, "Oh, I don't know what I'm supposed to be doing now, because you're the one that feeds them, you do all the things, and so I'm not sure what my role is." So having those conversations helps everyone to feel included and make the transition a little bit easier.
So thinking about partners, other family members, other friends who want to support someone, what are some helpful tips if someone wants to support someone else through their 4th trimester?
Yeah, so some of the things that we've been able to find have been finding support for, like, if it's lactation support, or being able to have that connection with different resources. If you're able to attend lactation groups at the same time to help with the process just so that you know what's happening. That's a great way. But then also just being there and being available to provide support, and acknowledging when there's needs that might need to be met have been some of the things that we've also heard over time. Just having someone to listen or to go out and make those connections for doctor's appointments. The other piece is being able to know when they might need to eat, or to make sure that you're keeping track of the different checklists, being able to take over things that could be delegated, and also realizing that sometimes there might be the desire to ask for help, but they don't know how to ask for help, or they don't feel they should ask for help. I am a notorious I can do it all superwoman. I know there's 13 million things to do and I need to do all of them all at once. I can do it. Yeah. But it's also helpful when I'm okay and saying and acknowledging that they're there to help for me. So just saying I'm here to do this, or I can do this. Is this okay? Is another way to check in.
And I'm so glad that you mentioned, asking for help and the difficulty that some people have. I am absolutely guilty of that. I'm just like, no, I'll do it later. Don't worry. But thinking about, my own experience, it's like, you know what? My husband might have needed help too. And so thinking about not just me being able to ask for help, but him being able to rely on support resources. He's a new dad, no matter how many kids we have, it's the first time with that child. And, there's so much going on and so many ways. And so just thinking about support for the larger family unit is also a good idea.
Yeah, that is definitely making sure that there's that support there, and even going not just like immediately at home, but even in the hospital. Mm-hmm. I can think of some of the stories that have been shared where there was a dad that kept walking out to the front to talk to the secretary. And the secretary would say, yeah, you're doing the right thing. You're there, because he didn't know what to do. Mm-hmm. And he said, I'm not sure what to do in this room. And his partner was in labor and pushing. And he said, I don't know what to do. And he said that the secretary kept saying, you're doing a great job. Now go back in there and do this. And it was like he had his own little cheerleader mm-hmm. telling him what to do and kind of walk through that process. And after I believe it was his wife, after she delivered, he created a group for fathers and to help them walk through that process, both in knowing how to ask and advocate for help in the hospital and knowing when something was wrong, but then also when they got out and were at home, like, what do you do next? How to change a diaper, how to do all these things, and being able to co-parent together successfully.
I think that's so awesome. That person was able to give him, some concrete directives. Here you go. But more importantly, perhaps, is that you're doing a good job. That mm-hmm. reinforcement that, hey, you may be scared. This may be unusual to you. You may have never been in this situation or been in this situation 20 times. But right now, right here, you're doing the work. And you're doing it well. And I think that goes so far for everybody in these situations. So patient, partner, and family members just getting that, that pat on the back, because firsthand, it's hard. This whole process is hard from start to finish, and it's different for different people, of course. But you know what? If I'm doing a good job and someone's going to tell me so, I'm going to take that.
Yes, absolutely. Absolutely.
So, Kimberly, we are wrapping up, but before you go, can you tell our audience more about the toolkits and materials available through the Fourth Trimester Project?
Absolutely. So online, you'll find at newmomhealth.com. It's our website where you'll find patient information, and it's been curated and done together with mothers and birthing people to have different aspects. So we actually worked with kind of the standards that the medical profession from the American College of Obstetrics and Gynecology had a toolkit for the healthcare team. And we took that toolkit and made it into something that could be patient and family friendly. So it has tips on supporting you in the postpartum period on lactation, or things that families can do. And we have some video reels that are coming out that are short snippets on how to ask for help and different tools. We also have a one-pager patient education sheet that talks about the maternal health warning signs, things that you should know when you should call the hospital or go to the hospital or call the doctor. And then what's normal in the postpartum period. A lot of times we do not know what to do or what's normal. And just having that content or information is definitely key. Some of the other things we have on the website is a provider toolkit. So for hospitals or practices that are interested in improving their postpartum care that's available to their patients and clients, there's a toolkit on how to work through your systems of care and to improve the care that's provided.
So, Kimberly, thank you so much for being with us here today. And before you go, is there a final thought that you would like to leave our audience with?
I think my final thought would be when you consider the postpartum period in the 4th trimester, ensuring that you have that village there for you. For us and for my family, it meant that we moved back closer to my parents so that I could have my parents and friends so that I could have the support that's needed, because figuring out the postpartum period is a lot. And being able to know that you matter and you have the support and the ability to care for not just the little one that you have brought into the world, but also yourself is definitely key. And finding that group and that tribe that can be with you makes a big difference.
Absolutely. And I'm going to make a small shout out to my village for supporting me all these years. You know who you are, and I couldn't do it without you. So thank you. And Kimberly, thank you so much for being on the show today.
Thank you for having me.
Thank you again, Kimberly. And for you listeners, we will have a link to newmomhealth.com on the Mother to Baby website, so feel free to check it out. And that'll end this episode of the Mother to Baby podcast. As always, thank you so much for listening. Don't forget to subscribe to the podcast so that way you never miss a new episode, and you can go back and listen to older episodes as well. You can find us on iTunes, Spotify, or however you listen to podcasts. And don't forget, Mother to Baby is here to answer questions about exposures before and during pregnancy, while breastfeeding, or in cases of adoption. You can reach us by phone at 866-626-6847, by text at 855-999-3525. You can visit our website at mothertobaby.org, where we have podcasts, but also you can live chat with us. You can look through our fact sheets or any of our other information pages. And if you have a question about the podcast, a topic idea, or if you want to be on the podcast, we would love to hear from you. Please feel free to email us at contactus@mothertobaby.org. So until next time, remember, Mother to Baby is here for you. Take care.
Mother to Baby is a service of the nonprofit organization of Teratology Information Specialists and supported by the Health Resources and Service Administration of the U.S. Department of Health and Human Services. It's made possible through generous donations from listeners like you. To learn more about Mother to Baby, please visit mothertobaby.org.